When caring for someone, you can be exposed to blood or other potentially infectious body fluids. While the risk of contracting a disease is very low, it is wise to take simple measures to avoid exposure in the first place. Infectious blood-borne diseases include hepatitis B, hepatitis C, and HIV, the virus that causes AIDS. Exposure can occur through direct contact of infectious material with an open wound or sore, or absorbed through the membranes of the mouth, nose, and eyes. Exposure can also occur through a skin puncture with a contaminated sharp object. Reducing exposure lowers the chance of infection. Standard precautions is a set of protective practices used whether or not an infection is suspected. To be effective, your approach is the same for everyone, regardless of the relationship or age. Personal protective equipment, or PPE, describes protective barriers worn to prevent exposure to infectious diseases. Disposable gloves are the most commonly used protective barrier. Make sure they are readily available and always use them. Inspect gloves for damage or tears when you put them on. If damaged, replace them immediately. After providing care, always remove contaminated gloves carefully. Avoiding bare skin, pinch the glove at either palm with the gloved fingers of the opposite hand. Gently pull the glove away from the palm and toward the fingers, turning the glove inside out without snapping. Gather the glove you just removed with your gloved hand. Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Throw away gloves in an appropriate container to prevent any further contact. Even after using gloves, use soap and water to clean your hands or any exposed skin. Use an alcohol-based hand sanitizer if soap and water are not available. Another commonly used PPE, a face shield, can be used to prevent mouth, nose, and eye exposure when there is a possibility of splashing or spraying.